Hello, I'm Dr. Roy Picard, and I created this video for the residents of Rochester, Michigan. What I'm going to discuss are the different types of tests that are often overlooked when it comes to helping a child who has either been diagnosed as having ADHD or strongly suspected of having ADHD. What I want you to understand is this. Brain function is the most important thing that needs to be addressed with these kids. In some of my earlier videos, as well as the information on the Michigan ADHD website, I talk about the functional disconnection syndrome, which is common to all of these kids, and how important it is to get the brain balanced. And brain function is dependent on two things: stimulation and body chemistry. The body chemistry has to allow proper fuel to the brain in order for it to function at its optimum level. So how do I determine which areas of the brain require additional stimulation? There are specific, non-invasive tests which are geared for specific age levels that tells me which areas of the brain require additional stimulation. Some of the tests will assess if there's a visual processing problem, an auditory processing problem, a motor skills delay, a lack of coordination, a problem with timing or rhythm, deficiencies with fine motor skills, deficiencies with gross motor skills, and much more. As far as the body chemistry evaluation or metabolic analysis, again, it's dependent on the child's ability, but we may need to evaluate things such as blood sugar, cortisol levels, the amount of good bacteria in the gut, if there's any bad bacteria in the gut or a fungus or a parasite. We may want to look at thyroid function, assess how well oxygen is getting to the brain. We can look to see if there's a high count of bacteria or viruses, check iron levels, liver function, immune system function, kidney function, and much more. What I want you to understand is this. There's a great deal that can be done for these children, but unless you are getting the right types of tests, unfortunately your child will not have the opportunity to reach their optimal physical, mental, social, emotional, behavioral, or academic level of performance. Also keep in mind that these particular tests that I'm speaking about, they need a functional assessment as opposed to just traditional medical analysis. For more information, you can go to www.michiganaddadhd. If you're interested in setting up a free consultation, then please call my office and speak to my friendly staff at 586-726-9860. Again, I'm Dr. Roy Picard, and I wish you and your child nothing but the very best.